Good afternoon. Thanks for sticking around for the last panel. We really do appreciate it. And I'm excited to have a new boss, Todd Clear, and to be here. Believe me, retirement was great. I think I might be the shortest person in history to experience it, but it is a wonderful thing to all of my colleagues. I have to start by giving a real brief statement about New Jersey's report card as it relates to gender responsiveness for women offenders. And I could barely sit still in my seat when Barbara Owen had mentioned that New Jersey had made a significant stride in the reduction of their women offenders inside Etna Mahan Correctional Facility. And I would be remiss if I did not acknowledge my previous employer in the House, the New Jersey State Parole Board, and how hard they worked to receive that attention. The board, as well as the captains and the lieutenants who are present, as well as the officers themselves who supervise those women offenders, I think rightly so, are very humble and don't often get the recognition that they are known nationally, as well as within this state of New Jersey. But you are nationally known without each of your names, but your work is nationally recognized. And for that, I think you need to receive a hand of applause because you're making a difference. So our report card looks like this, or it did when I worked for the board. I think it still does. And now as I work for Rutgers University, I'm proud to say that we will pick it up and really evaluate all of this. But in 2004, the New Jersey State Parole Board, established the first female offender reentry group effort project. It started out as a pilot project in Essex County. Then in 2008, the board and Department of Correction collaborated on the female offender integration reentry management system to look at the pre-release system and see if they could collaborate with parole to see if there was a difference if they started before the women got out to do a few things. Then in 2009, there was a collaboration with the Women Reentry Conference with Parole Division on Women, and at that time, Rutgers Center for Women in Work. So in 2009, they held the first statewide Women's Reentry Conference. And you had Volunteers of America in New Jersey, ACA was involved in that also. So here we are 2 years later to say that we have made a difference and we have been moving. In 2010, the National Institute of Corrections came to the New Jersey State Parole Board and delivered training on the WOCA model in January and March. Also in 2010, the board had a positive year and they were awarded federal dollars to expand the FORGE program into Passaic and Camden County. And then in 2010, as Barbara has stated there, we were pleased when we got acknowledgement from the Department of Correction that the numbers in February 2010, the then administrator said, were actually 814. I have the numbers embedded in my head. 814 women were inside of Etna Mahan with another almost 300 in community corrections. That was the lowest that they had been in 20 years. And they had under 20 women waiting to be transferred to Etna Mahan with a state sentence. So New Jersey is underrated, and we're humble in what we do, but we appreciate the national attention. And I think the board and the workers, the supervisors and the officers should be proud of that. Moving on, as we sit here today, we have a distinguished panel before you that I think these practitioners can discuss with you even further more things that they're doing as it relates to women offenders, taking the assessment models and putting them in practice, actually running gender-responsive programs across the state, and then what it means to policy and possible recommendations for the state of New Jersey. So you have Dr. Ralph Fretz, who's a licensed psychologist with community education centers, and he's worked in a variety of populations or with a variety of populations, including children, juvenile, and adult offenders. You have Pat McKernan, who has served as Chief Operating Officer for Volunteers of America in Delaware Valley, and she's had a variety of experience as she represents the leadership now for president for the Coalition of Community Corrections Providers. And then you have Ms. Keisha Middlemass, who will talk to you about the collateral consequences of a felon conviction and really gendering that aspect of the whole thing. And she's a current assistant professor for the Department of Political Science at Rutgers University in Newark. And so let's put our hands together and welcome this distinguished panel. And Dr. Fretz will be our first speaker.
What I want to do is talk for my time more about I guess it's a secret more than anything, that New Jersey has been conducting research for some years. I think with the Institute coming on board, it'll be much more enhanced and more productive than it has been. But there is published research out there already on the efficacies of the programs that are being run in the community, the RCRPs. This is not based on anecdotal evidence or discussions about papers or some other things. This is based on hard data that has been developed over the years with collaborations with different universities, including Drexel University. And I see Jeff Mello out there with the John Jay has been a collaborator with us. And there's other people that we have worked in partnership with over the years to develop this model. And the model is, again, a collaboration between departments of corrections, the parole board, and also all members of the RCRPs. The continuum of care model is what we have developed in an evidence-based manner, and there is now research that has been published in peer-reviewed journals that indicate that there is an effectiveness to it, which is what I'm going to talk a little bit about today. First one is an article that ended up being published in the 2008 journal, I believe it was Criminal Justice, and no, this was in the compendium, and there's another article in there that Criminal Justice and Behavior published. These are all peer-reviewed journals. This one was taking a control group, a Department of Corrections control group, and comparing it with people, females, this is women, who have gone through the continuum of care through the assessment centers and then out into the halfway house programs and then back into their community. The findings I find are pretty interesting. You're looking at up to a year out, there's a 50% reduction in rearrest of females who have been going through the continuum of care. This was done through a university. The data was gathered through the Department of Corrections, not through the private vendors. The analysis was done by Drexel University. They have a forensic psychology and law program that Dr. Kirk Heilbrunn had analyzed the results with his group, sent them back to the Department of Corrections. The Department of Corrections then sent them on to us. So we did not have any hand in any of the results except once it was being published. Further research was done, again, this is by Kirk and also Department of Corrections in New Jersey, on pathways, which has been discussed, I think, earlier, towards females going into the system and looking at a fairly large sample and comparing it to males. You have this study, as I said, was accepted and also published in the Criminal Justice and Behavior, I believe it was 2008. There was over 1,000 males that were looked at and about 700 or 800 women. So it's a pretty large sample, particularly for the female population. Findings included, and this is kind of consistent with what the speakers this morning discussed, in fact, it's very consistent, I think, with that, is that looking at the LSI results, that the women fared worse in the financial domains, meaning a lot of gals have been on public assistance and some other areas before that they were incarcerated. Companions, the women were worse. Again, if you look at, you have to be able to interpret the results based on gender. You can't just say, okay, they're worse. It's worse because the women hook up with guys who get them in trouble, which I think somebody said this morning. Right, Barbara? Yes, you did. That's right. I'm not walking around because I'm the only guy who's actually doing the... So I'm sticking to my gender today and just going to stand behind the podium. But The reason, it's interesting when the results have been looked at in other venues that if companions are with other women, they tend not to reoffend. It's unfortunate, but when they hook up with men, that's when they tend to get into trouble. More women were found in these assessments to have been married or widowed versus the guys. And again, consistent with other data, the alcohol and drug abuse domains were more severe for the gals, for the women. And I think that has probably there's a whole bunch of different interpretations that can be made of that, but either way, it's consistently found in all the data. Where am I time here? McKernan's going to give me the hook in a couple of minutes.
Really bad timekeeper.
What I want to try to really put out there today is that New Jersey has developed and is continuing to develop and will continue to develop an enhanced gender-responsive programming. There are certainly some very, very good, I think, community-based programs that have utilized Covington and Bloom and other people's work to enhance the already existing programming. And I'd like to think that there's an example, and she's here somewhere. There you are, Dr. Mims. Dr. Mims runs our program at Bo Robinson, and she's involved with other things. And her work is a good example, I think, of gender-responsive programming at a facility, but she's also doing research on female offenders, not just saying, okay, now you're here in the facility, see you later, have a nice day, see you next time. Instead, she and her group are following female offenders as they're leaving the system and following them for 6 months afterwards to see how they're faring in this. And it's interviews. It's not just data crunching, although data is very important, do archival data and other things. But she and her team are actually interviewing women who, as they are leaving the system, and then following them for 6 months to see what challenges that they face. I believe this has been done before, but it's a continuation of that. Do you think so, Barbara? Has that been? Not enough. Yeah, I agree. And this is also, again, another example, in my opinion, of the New Jersey partnerships between parole, Department of Corrections, that is doing research and has been doing research and has published research for some time. In fact, I wrote an article in 2007 with Drexel University student and Dr. Mims that was, much of it was based on Dr. Owen's work of teasing out the recidivism in the very, very large sample that was done through across the country. So there is stuff out there, but I do think that the work that the Institute's going to be doing is going to actually really very much enhance what has already been started. And I think it will go even further. And this kind of collaboration has always been important to us in the community programs. Pat, I know in VOA, has done collaborations throughout the years with Rutgers and a number of different places. So I guess it's a kind of a secret, maybe, that people have been doing this for some time and have actually published articles. So that's really my message, is that that the programs that have been out there have been evaluated. They are evidence-based. The gender-responsive programming have been in place for some time now. It can continually get better. I think it will get better as more and more evidence is involved. I know she's not paying me, but Dr. Mims also recently was under training with Pat Van Voorhees' crew to do the, what is the name of it, Angie? What's it called?
Women's Risk Needs Assessment.
Right. So we've just started to implement that at a facility at Bo Robinson. Drexel students, along with Dr. Mims, are doing some assessments with our female residents there. So we are in a continuous state of hopefully evolving into more and hopefully better programming. So that really is my message. Pat is going to be able to give, I think, some very specific information about some good, strong programming that the VOA has been doing for some time with female offenders. I think it's probably pretty similar. We all kind of go from the same neck of the woods, which is, I think, Covington and Bloom, and also Canadian. No, oh, okay, she's not going to do that. So we do Covington and Bloom.
You didn't put it right on there. By the way, you're out of time.
I'm out. Yeah, I figured. Now I'm out of time. All right. Well, thank you. I'll hand this over to Pat.